Your insights will undoubtedly benefit our community healthcare professionals to enhance the patient care in future. And now I welcome our next speaker to share the experience. Sir, we'll have a discussion at the end, sir. So the session is not completed. Yes, sir. We have time for that. Thank you. So now I welcome our next speaker, Dr. Mangaya Karsi, PLEX Nodal Officer, retired from Coimbatore Medical College Hospital, to deliver a sharing experience on PLEX for rodenticide poisoning.
Good morning, all. I am here to share our experience with respect to transfusion medicine department. I am sharing how my experience in initiating the program and in maintaining the program and what are the difficulties we have faced. So I am not going into the treatment part. So it's not my job. I am talking about the experience we faced as a blood bank person. So our experience started with our training in CMC Vellore in 2022. And our CMCH Coimbatore Hospital, blood bank persons, medicine department, and emergency department medical officers, nurses, and lab technician, we went for training in CMC Vellore. And we were given training by hepatology department and transfusion medicine department. And there we were given about hub and spoke model of treatment, and also about hands-on experience on PLEX. And hub and spoke model was well explained to us in CMC Vellore, and we were well explained about the primary care, secondary care, tertiary care, and the PLEX training was given to us. And next, this is our experience in CMCH Coimbatore. After getting training, we started PLEX in January 2022. So, first, it's only 94 cases. Totally, the statistics has increased, and the cases taken for PLEX has also increased, and it is a number of cycles, and it is the percentage of the person who were discharged. This is our census in Coimbatore Medical College Hospital, our blood bank census. And here I want to mention about 3 important cases where we met with success. Case 1 is Saktivel, 30 years old. He consumed 2 tubes. His INR is 5.73. He was with hepatic encephalopathy and coagulopathy, and 3 cycles of PLEX done. And he survived, and he was discharged on 25/9/23. Second case, he consumed 3 tubes, and his INR is 6.6 and the bilirubin is 8.2. He was also with hepatic encephalopathy and coagulopathy. He was intubated, and 3 cycles of PLEX done, and he was discharged. This is case 3, 23 years old. She consumed 4 tubes, 4 full tubes, and bilirubin is 6.3 and INR is 5.3, 4 cycles of PLEX done, and she was discharged. Why I am mentioning these 3 cases? Because with increasing, this is a starting INR value. So with increasing INR value and increasing liver enzymes, so without PLEX, only we have to go for urgent liver transplant. But with 4 cycles of PLEX, the patient has survived, and we discharged. So, along with the training given in the CMC Vellore and with our experience, we have been selected as Apex Training Center. Already I have mentioned in the warning. And here we are giving training to all the people belong to entire state, and general medicine, anesthesia, nephrology, gastroenterology, and our blood center. All the faculties were involved. and a dedicated meticulous training was given to the people. And the training period was between May 2023 to Jan 2024. And now again the second session of training was also over. Because I retired, but now the second session of training was also over. The general medicine department will talk about the primary and secondary level of treatment, and they will talk about the hub and spoke model of delivering the treatment. And anesthesia department, they gave training about the vascular access, how to keep the vascular access sterile, like that. They were giving that training. And nephrology person, he was kind enough, Dr. Arul, who was transferred from Madurai. He will compare the centrifugal flux and the membranous fluxes, and he used to say that centrifugal fluxes is superior than the membranous fluxes with respect to rationale poisoning and plasma exchange. And gastroenterology, they also gave the training, and we gave training in plasma exchange for all the technicians, staff nurses and the medical officers who attended the training. And we have trained 169 doctors, 169 nurses and 76 technicians, and altogether PSC and Taluk Hospital 131. And our awarded accolades were, we were given a state award, our dean received a state award for, from the Tamil Nadu chapter of gastroenterologists, and there was a, I think morning Ipansa has there is a publication in Lancet, and our Honorable Health Minister, he has inaugurated the training, and a state level handbook on poisoning is released. Please everyone get that handbook. It is very, very useful. Everything is given in that handbook. Our dean is receiving the award in 2023, and in 2025 again our Tamil Nadu chapter of gastroenterologists, they awarded for saving the young lives. Now this is very important thing. These are all our experience. Now what are the challenges we have faced? I want to discuss in depth. First, because we are the one first initiated this plasma exchange for rationale poisoning. Already we had one centrifugal apheresis machine in Coimbatore. We received it in 2016 for other medical conditions like Guillain-Barré syndrome, myasthenia gravis, etc. So we used that machine for plasma exchange for rationale poisoning. So we have started very earlier, and our technician also well trained in plasma exchange already. So we have started doing the plasma exchange very earlier. But the program initiation was very difficult because plasma exchange for rationale poisoning is a novel treatment, and there is a programmed treatment. So to sensitize the clinicians to use PLEX for rationale poisoning was initially difficult. So the program initiation was little bit difficult. Why I am telling this? Because there will be people who have come from other districts who are going to receive the equipment also. So please get sensitized with the program, the PLEX and the rodenticide poisoning, and the program initiated by the NHM and Tamil Nadu government, and also about the hub and spoke model of the treatment. So program initiation was initially very difficult, because sensitization was not there. Now it is very easy. So sensitization is necessary. Then it's not top problems. Top-down approach is necessary. First, our administrators should be sensitized. That is our government and NHM. They should sensitize our head of the institute, our dean. So in CMCH Coimbatore, once our dean got sensitized, and I think I have to thank gastroenterology Tamil Nadu chapter, because after the state level award from in Trichy in 2023, Madam got sensitized, and until now she is giving a full support for the PLEX for rodenticide poisoning. So first, head of the institute, the dean should be sensitized about this program. in all the medical colleges because it's a novel treatment. You have to initiate that program once you have received the equipment. So once our dean got sensitized, unwavering support she gave us. So top-down approach is needed. Then second, equipment. First we started the program with our old equipment, then we received the new equipment. What I want to tell NHM is the CAMC and the repair and the fund needed, what to do, because if there is a small repair, we have to shell out up to 2 lakhs for a very small repair. So it's very difficult for a government hospital and the head of the institute to spend money for the repair. So what I want to convey, the equipment of CAMC should be borne by the distributor for some time. Something should be done for that because it is very, very difficult. So Lydia, please note it. But for equipment CAMC, it should be done. Something should be done on our side because it is very difficult. Even a very small problem, you have to shell out 1 or 2 lakhs. So regarding CAMC, repair and the fund, that should be clarified because the old equipment still it is under repair. We are not able to do the repair. Then third, consumables. The consumables, you need a PLEX kit, you need the W1 catheter, and initially the problem what we faced, but everything is settled now. We will fix the PLEX program. For the W1 catheter, our PG, medicine PG, he has to go to nephrology department. He has to wait for a day or half a day to get that W1 catheter for plasma exchange. But our toxicology chief and our HOD medicine, they have discussed and now they are purchasing in, I think by medicine department, and they are keeping it in toxicology ward. These are all the practical problems we have faced. I think it will be everywhere in the government institute. Who to purchase the PLEX kit, who to purchase this W1 catheter. So what availability of it, supply of it. So these are all the ground level problem. So we were purchasing the PLEX kit and toxicology department is purchasing the W1 catheter. What I feel, some single ownership. A single owner should purchase the PLEX kit, W1 kit, and they have to keep it continuous supply and uninterrupted supply. This should be made. And manpower. Manpower. So what we have planned, the transfusion medicine department has to do plasma exchange. But all government hospital, they have only 2 TANSACS employed technicians. We don't have any permanent technician only. We have 2 technicians. So because it's a high-end procedure, the technician should be trained well and constantly we have to send the data to NHM and to whenever it is needed. So definitely a data entry operator is needed. All the problem I will put in front of you. Whatever it is possible for you, you please do. So data entry operator is needed and it's a high-end procedure. A lab technician should be well trained. I will share my experience, how I tackled this problem. We had 2 technicians. They were well trained in plasma exchange. They started doing this. But suddenly what they started telling, ma'am, we have a regular routine work. We have screening work, we have to do grouping, cross-matching. Apart from that, how we can able to do this? So they started a problem. Then I approached the distributor and he employed the lab technician and he is paying some money. And now I have a dedicated lab technician for plasma exchange, but he is sponsored by distributor. So I heard that few centers he was doing, so we demanded. I don't know whether it is correct or wrong, and we are doing that because regular lab technician in the blood bank, I think everybody will be agreeing. Only 2 persons are there. It is very difficult for them because they will have up to 4 o'clock they will work and again they have to. So I tackled that problem like that, lab technician problem. And training the lab technician, even though we are training, but the hands-on experience, loading the kit, unloading the kit, the troubleshooting of the equipment, he should learn it. So what I did I asked the company technical expert to come and train our technician. So once you get trained in the Apex Training Center, then you, the transfusion medicine person, get the responsibility to call the technical expert of the company, whichever equipment is supplied to you, ask them to train your lab technician for loading, unloading, troubleshooting of the equipment. So that's how I tackle that problem. And the procedural problems to the patients and to the equipment, air locking, so many problems are there. Everything your technician should know and we should also know. And ownership of the program. These are all the problem I faced and I corrected. Our team, it's not I, our team corrected. So the ownership of the program, we should be very, very clear hereafter. The transfusion medicine person should do the PLEX. But the demand should come from the person who is treating the patient. We should not meddle with the patient. They should decide. They should tell, you can do this and that. Our team, we have to go and do the PLEX, that's all. So this should be clearly defined. So that thing you have to take care of. I am here discussing only the ground level practical problems. Then regulatory acts. All our transfusion medicine person will be confused about the regulatory acts. And I discussed about with the drug authorities. Actually, we should not do the therapeutic plasma exchange or PLEX in blood bank. We should not do in the blood bank premises. It should be done in the toxicology or ICU or a high dependence unit. Our technician should go and do. And if you have a machine there, it's good. Otherwise, the machine which is in our thing, it should be properly transported with a lift or some smooth road. You have to do. And we should not do the plasma exchange in blood bank premises. But only transfusion medicine person should do the PLEX. And the indication should come from the physician. So, and regulatory acts say that the blood bank should get the AFSS license. We should get the license. There is no need for the physician or treating person to get the license. So, we have to get the license. Few suggestions to the administration. We should get uninterrupted PLEX kit supply, because we faced difficulty from 2024 Feb up to this year. So we have started the program. See, you are going and starting the program, and you are sensitizing the transfusion medicine, clinician, dean, everything, and the public is also sensitized. So they will start coming. What will you say to the public when your kit is not supplied without interruption? So you should make sure that, because again I am telling, these are the problems we have faced. So there should be uninterrupted PLEX kit supply. And the next thing, in the government setup, a tender will be over. Then I think Lydia will be knowing. The tender was over by last year June. And I think the tender was, again the new tender, now I think March or something. So up to this time, the dean of the institution, she has to buy the PLEX kit, but it's what I can say, it's a really troubleshooting for her, because without a TNMSC rate contract, how a dean can purchase, no? So there should not be any, these are all the problem we have faced. So avoiding delay after completion of the tender tenure. And there are so many equipments in our government setup. We have, I think in the market, we have Spectra, Aptia, Fresenius, and Humanetics. 3 types of equipments we have. And a few government hospitals, they have the Humanetics. 1 or 2 hospitals, they have Fresenius, and a few hospitals have Spectra, Aptia. So we have to, I think, you have to utilize all the equipments. Few equipments are just not utilized, and we have to form a PLEX team, and we also maintain a PLEX team. It should be a state level PLEX team. So you have to keep a PLEX team state level. They have to discuss about the problem, because we were left alone, because we were the pioneer in starting in government, and we were doing, people were sensitized, patients are pouring in, but the problems we were facing about the PLEX kit supply and the repair of the equipments and the delay in the tender tenure, these are all very difficult. So what I feel, you have to form a state level PLEX team to discuss all the problems, so that the program is running smoothly. And the SOP should be displayed everywhere, in the ward, everywhere. And I think our HOD medicine will talk about it. This PLEX for the rat poisoning should be included in CMCHIS, and it should be meticulously planned. And if it is included in CM insurance scheme, I think it will even, we can do better. And the program should be, sensitization of the program at all levels should be done. And this is the last point I want. The success for our center is, we have a coagulation lab in our blood bank, and it is sponsored by NHM hemophilia thing. So we have a rotum in our blood bank. So it was easy for us immediately before we get a report from pathology department, we can able to say PT, APTT, INR, fibrinogen. Even we have done factor 8 assay in our blood bank. So it was very easy for us. So, and the treatment is also not delayed, the component therapy, whatever it is. So it is I feel it is very important to establish a coagulation lab in all the transfusion medicine department. So I am asking you this. That's all. Thank you.
Thank you, ma'am, for your comprehensive overview on PLEX therapy for rodenticide poisoning, which is truly informative.